One of the things I wanted to highlight was a new scientific method that we've been using. It's called nutrient co-transfer technology. It's essentially a way of using one nutrient to enhance the function of another nutrient, and that could be electrolytes, amino acid, proteins, anything. And the idea is that if there are two electrolytes or nutrients that are not delivering the function you need, a third nutrient can be introduced to enhance the function of that electrolyte or electrolytes. We've used that technology in both our products. So in MAGNAK, just having sodium, potassium, along with sugar and water was not enough to help with the muscle physiology or prevention of muscle cramps. And that led to the introduction of magnesium in the electrolyte mix. By virtue of magnesium being the principal ion, it allows two things. One, it causes vasodilation because magnesium acts on endothelial cells and leads to a peripheral vasodilation, which allows perfusion or blood supply to the exercising muscles. And that causes sodium delivery to the exercising muscles. And the second thing it does is it allows the potassium to be retained inside the system, because having magnesium deficiency leads to more potassium loss and less potassium retention into the human body. So magnesium actually almost exploits the function of both the sodium as well as the potassium, and by virtue of that, at least in endurance athletes, it helps prevent muscle cramps. It reduces the soreness so that they can do more every day and come back to do even more. So one of the challenges we faced for many years is really having the optimal electrolyte mix. And while a lot of other formulas existed which had sodium and potassium, one of the major concerns with marathoners or endurance athletes was really cramping and soreness, and that really limited their ability to train further. And this really led to the birth of the MAGNAK formula. And what is different, or almost a paradigm shift, is we use 25% of recommended daily intake of magnesium per serving. So that's 100 milligrams of elemental magnesium per serving. And what that allows is not only to improve the perfusion and sodium delivery of the exercising muscles, but also helps in potassium retention without causing a peak in blood potassium levels, which are very common when people are having a small amount of rhabdomyolysis during the marathons and ultramarathons. So by virtue of having a proper blend of magnesium, sodium, and potassium, we're allowing the perfusion of the muscles, preventing and reducing exercise-related cramps and soreness so that athletes can actually do more every day. So Humolyte was almost something that was brought into attention and was led to discovery by some of the patients who were using the MAGNAK electrolyte formula while they were on chemotherapy. And we realized that patients who are having gut injury related to chemotherapy, antibiotic use, C. diff colitis, inflammatory bowel disease, there was a bigger challenge because just oral rehydration solution would not help fight the dehydration, because all the electrolytes and water that is replaced by mouth would still continue to leak out because of the gut injury pattern. So we decided to utilize the nutrient co-transfer method, where we used, in addition to the MAGNAK formula, a prebiotic which was first isolated from the human milk. And this prebiotic is called 2-fucosyl lactose, and 2FL has been known to improve the gut barrier membrane integrity. So by allowing that, it almost heals or repairs or maintains the integrity of the gut barrier membrane. And this allows the electrolytes that are delivered through Humolyte to be absorbed from the GI tract and maintained in the gut without leaking them back into the system by way of diarrhea. So Humolyte was one of the first human milk oligosaccharide drinks that was conjugated with MAGNAK formula, specifically for patients with gut injury.